year, about 5 million Americans have heart failure, and about half of people who develop heart failure die within 5 years of the diagnosis.
Well, joining us to discuss this is Dr. Alexander with the ETMC Cardiovascular Institute. Hello.
Hi, how are you?
We're good.
It's a pleasure to be here.
Yeah.
Your heart is a muscle that pumps blood throughout your body, and heart failure is a condition that pretty much is a cause of multiple reasons where your muscles are unable to perform and deliver blood to the vital organs. Now, causes of heart failure vary, but mainly heart disease itself or previous heart attacks can lead to deterioration and heart failure on its own. In terms of treatment, it varies as well. However, optimal medical therapy is what we'll look for with the utilization of certain devices. For instance, CardioMEMS is a new technology that we're trying to bring to Tyler, and that will actually help us to monitor patients remotely. Your physician will be able to log in into a smartphone and be able to tell if your patient is overloaded, and the treatment will be adjusted over the phone.
Wow. Okay, so this heart failure, I mean, it's not curable. It's just something you treat, or?
It depends on etiology of heart failure. There are different causes, as I mentioned. But let's just say, as a cardiologist, what we do, we try to optimize and find the right therapy that will stabilize it. And at times, based on the age and the cause, it can actually be reversed.
So what are some of those therapies then?
Well, in terms of devices, we have ICDs, which is a defibrillator that kind of provides an alternative to your heart muscle to have that backup generator. CardioMEMS is a device that can actually tell us what volume status does your patient carry at a particular time, and we can remotely adjust the medication. Some patients are unable to come and see us immediately, and that ability to tell where your patient's heart failure is at a particular time can definitely be essential for that patient to be managed appropriately. And if you can prevent one hospitalization, it's a huge burden in terms of financial and overall quality of life for the patient as well.
Now, what are the symptoms of heart failure?
Symptoms, very important questions, and thank you for asking that. Symptoms also can vary, but the most important ones are shortness of breath, inability to exercise, inability to lay down flat, fatigue, weakness, cough, mainly chronic cough or worsening cough, and leg edema, abdominal edema. And when I say edema, I mean swelling of the legs and the abdomen. And I think it's important to recognize the symptoms because in a long run, the mortality and the prognosis is extremely poor if it's not appropriately managed or recognized at the right time.
So if somebody's experiencing these symptoms, how would they get a hold of you or your office?
The best thing to do is to go etmc.com, find CVC Cardiology, and we have a team of great 10 physicians who practice a variety of cardiovascular medicine, and we will tailor that perfect regimen that will help the patient ultimately progress into heart failure, to stabilize it, and overall to have a better quality of life.
Okay, thank you so much.
You're very welcome.